more women leak urine than have diabetes, hypertension, or osteoporosis.
I am speaking to Dr. Sara Reardon, who is known online as the Vagina Whisperer.
More partners and medical practitioners have probably seen this part of your body than you've seen yourself. It's not just after pregnancy or birth that pelvic floor issues can occur. It's at every life stage of being a woman. The narrative for pelvic floor training has always been to strengthen, do your Kegels, tighten up, suck in, hold tighter, and that is not necessarily what every woman needs.
Even high-level athletes, box jumping, pee on themselves.
Diapers should not have to be our destiny because these issues don't get better with time. One of the most common causes also of prolapse in women who have not had babies is actually constipation.
So we need more fiber.
We need more fiber and we need squatty potties in every bathroom.
Hey everybody, I want to show you something. This is the view out of the pelvic floor. And it's apropos today. Okay, I've never shown you a pelvis before. Maybe I have, but it's apropos today. I just kind of want to have it here for a minute. It's apropos today because I am speaking to Dr. Sara Reardon, who is known online as the Vagina Whisperer. So thank you so much for coming today.
Thanks for having me, Vonda.
I think it'll be fun because listen, of all the secret places in our bodies, most women, unless they hear one of us talking about it, have no idea what goes on down here. And yet 80% of us are affected by weakness in this place. And as a musculoskeletal doctor, I'm all about the pelvic floor, not because I'm a pelvic floor doctor or therapist, but because it's made out of skeletal muscle, which is kind of my jam, right? So I'm just fascinated by holding this. So sorry, guys. There you go. By the way,
this is my day-to-day life.
I know. This is where your babies come down. It's a miracle. It's a miracle. Who can fit through there? Well, our children,
right. Everyone, actually.
Everyone fits through there. Oh, my God.
It's pretty incredible because you're so right. These are skeletal muscles. Every gender has them. It's not just people with vaginas, but these muscles are so integral to movement and exercise and breath and pelvic organ support and just even things that we do every day like urination and bowel movements and sexual activity. So I'm so thrilled to be on to share this information with your community because I think most people don't even know that they have pelvic floor muscles.
I think you're right about that. And so let's go real basic. Let's go, because in the course of our conversation, I do want to start really basic and then we're going to nuance our way to more complex stuff. But I've shown, I'm fascinated by this. What is the pelvic floor? What is it attached to? How many muscles? When is it good? When is it bad? Let's just cover the basics because nobody wants to admit that 80% of people are incontinent at some point, or that even high-level athletes, box jumping, pee on themselves. Let's just be graphic here. It happens. I've seen it on the internet. So let's talk about it.
Let's talk about it. So your pelvic floor muscles in that pelvis that you just showed are those muscles are literally the floor of that pelvis. So they sit like a basket. They attach to the pubic bone in the front, the tailbone in the back, and side to side to your sit bone muscles. And these muscles support your pelvic organs. So in the female body, the uterus, the ovaries, the bladder, which holds urine, the bowels, which hold stool, all rest inside of this muscle like a basket. In the male body, there is no uterus and ovaries, obviously, but we do have the prostate. These muscles also have 3 openings at the very bottom of them. The first opening is the urinary sphincter where urine exits the body. The second opening is the vagina for vaginal intercourse, vaginal birth and menstruation. And then the third opening is the anal sphincter for bowel movements or anal intercourse. But these muscles also work with your spine to provide spinal stability. They're part of your core muscle complex and they work in conjunction with your abs and your deep core muscles. And they literally are contracting and relaxing all throughout the day with every breath that we take, with every movement that we make, with every weight that we lift. And to your point, many people don't even realize that they have a pelvic floor until they have a pelvic floor problem. Some of these issues range from urinary leakage, which you mentioned, fecal leakage, pelvic organ prolapse, sexual pain, decreased orgasms or the inability to orgasm, but even things like back pain and hip pain. We don't think of the pelvic floor as a culprit, but this complex is made up of 36 different muscles that attach to the pelvis. And so there's
36
so much,
muscles.
36 muscles are attached to the pelvis and are all related to these pelvic floor muscles.
No wonder it's complex. Maybe it was taught where you went to school, but I'm sure you had specialized training on top of standard physical therapy. Nobody talks about this. And yet, it's like the southern hemisphere of our bodies. I talk all the time about butt, core, and hips. Every hip pain, every knee pain, people with hip pain, people with knee pain, people with back pain. I'm sending them for butt, core, and hip strength because people assume knee pain has to do with their knees. Sometimes it has to do with their pelvis. But thank God my director of physical therapy in my office is a pelvic floor therapist, because so many times, what percentage of the time would you say it's not just your back, it's not just your hip, it's your pelvic floor?
Right. There are studies that show that 70 to 80% of folks with low back pain also have pelvic floor dysfunction. And so when we're screening for, and low back pain is probably the most common orthopedic complaint in the United States. So it's when we're talking about or screening patients for these issues, we need to ask those really difficult questions like, do you have urinary leakage? Do you have discomfort with intercourse? Are you able to have orgasms? Tell me about your childbirth history or menstruation history. We need to go deeper into the pelvic floor because this is a really integral complex that a lot of folks are missing. And the way that our medical system is siloed, where we have a musculoskeletal doctor, a bone doctor, a uterus doctor, a colon doctor, nobody's screening the muscles until they get to a pelvic floor PT.
And so, in addition to the 5 or 6 themes you just mentioned, which I'm so glad you did, because I firmly believe that we don't know. We can't listen until we know, right? Our body talks to us all the time, but we don't know. What does uterine prolapse and what does bladder prolapse feel like if the organs are not hanging out of our vaginas yet? But what do the early stages feel like?
Pelvic organ prolapse is when this hammock of muscles isn't supporting those organs as well as we would like. And that can be due to ligaments that kind of tack those organs up or weak or strained, and or these pelvic floor muscles are weak and they're kind of everything's drooping down. What you'll start to feel with prolapse is it'll feel like something's falling out of your vagina. It can feel like a bulge at the vaginal opening. Oftentimes I have patients come in, they'll say, I was washing down there and I felt like something was at the opening of my vagina.
So
It
all
can
the
feel like,
way down at the opening, not
yeah.
up by our cervix, but all the way down.
And you don't feel it when it's high up in the cervix because our sensory nerve innervation is more kind of heightened at that lower third of the vagina. So not until the organs get to that lower third of the vagina do you start to feel that kind of rubbing heaviness sensation. And that's what we call a grade 2 prolapse. The majority of female bodies, to be honest, probably have what's called a grade 1 prolapse, which is, 2 centimeters above that vaginal opening. But once we get closer to that vaginal opening, we start to feel it. Other symptoms can be feeling like your tampon doesn't stay in, it's getting pushed out, that you're not emptying your bladder well. It feels like something's always in there, or that you're not emptying your bowel movements well. And it's what we call a poop pocket. So there's like poop that's pushing into that rectum and it's kind of pocketing in the vagina, in the vaginal wall, and not emptying. So those are some other signs as well, outside of just that heaviness or bulging or kind of drooping feeling inside the vagina.
And does that always, those feelings, as women are out there like, oh, that's what that is, do they always start postpartum, or can it be during your intensive athletic life? Can college kids feel this? When does this start?
There are 3 times that we see prolapse occur most frequently, and it's pregnancy, after birth, and then also in menopause, because our collagen and our estrogen levels are changing and that decreases the support of those pelvic organs. But it can absolutely happen in female athletes when we think high impact exercise like, runners, jumpers, heavy weight lifters, any of those higher impact sports or activities, they also have a high risk of prolapse because it's what we call pressure management. When you're lifting something heavy or straining or jumping, that pressure kind of creates inside of this pelvic cavity and it's looking for a place to go, and it's going to look for the path of least resistance. And for people with vaginas, it's the vagina, and all of that pressure starts to push down. So we see this a lot in, younger women. And I'll tell you, one of the most common causes also of prolapse in women who have not had babies is actually constipation, because
Oh,
chronic straining with bowel movements weakens your pelvic floor more than running or jumping or coughing. It's actually chronic straining.
so we need more fiber
Right. We need more fiber, and we
and
need
water.
squatty potties in every bathroom.
Oh, yes, we can talk about that. I've seen, actually, a girlfriend of mine had one in her house the other day. I'm like, oh, I know what that is. But, well, are there any myths? God, people have learned so much already in the last 10 minutes of this podcast, but are there any myths that we just need to expel now about the pelvic floor other than A, are there any myths? And B, don't you think people should look with a mirror down there so they even know? Because as you're describing the 3 openings to the pelvic floor, there may be people who have never seen that.
Yeah. I would say that most people have not seen this part of their body. And I highly recommend monthly vulva checks, just like we do monthly breast exams.
Because you can
And
get
so
cancer and stuff.
you can get, there's also things like atrophy of the labia. There can be dermatological conditions. There can be where the clitoris, the hood kind of gets stuck. It's called clitoral phimosis. But also, this is how you can start to know what your normal is. So if something's changing, you can see, oh, there's a change down there because I've been checking monthly. So I'm a huge fan of monthly vulva checks. I always say more partners and medical practitioners have probably seen this part of your body than you've seen yourself. And so it's a great way to kind of just get informed and educated about your own body. To answer the first question about myths, I think you just debunked one, that it's not just after pregnancy or birth that pelvic floor issues can occur. It's at every life stage of being a woman. And the other thing is the narrative for pelvic floor training has always been to strengthen, do your Kegels, tighten up, suck in, hold tighter. And that is not necessarily what every woman needs. I would say half of my patients actually have pelvic floor tension, and doing Kegels or strengthening could actually make their symptoms worse. So it's very nuanced. It's not just like strengthen your muscles if you leak or you have prolapse. It's very nuanced with respect to every individual is different, and we need to look at, do they have tension? Do they have weakness? What are their activities like? What are their menstrual cycles like? Are they on hormones? All of these things to really get a kind of crisper picture as to how really to lead that woman towards, better pelvic floor care.
Well, that's something I did learn recently, actually, from my own pelvic floor therapist in my office, is that sometimes, so we've been talking a lot about this basket hanging down like this, but many pelvic floor problems are almost like tetany. It's like, so
Yes.
tight. And it's an interesting dichotomy, as I talk about it a lot now and learn, is that if it's so lax like this, you may not even know how to flex. And if it's tetany like this, it's already too flexed, right?
Right.
So how do we get at this? A, we don't look at it, but B, how do we get at how we even, because it's easy to see a bicep, right? Oh, watch my guns.
Yeah.
How do we get out what's going on individually?
So there are different ways. You can always see an in-person therapist. I think that they will do it's an intravaginal pelvic floor muscle exam to assess the muscles. And they will let you know whether there is tension or weakness or incoordination of the muscles that are contributing to your symptoms. I also have a quiz on my website. It's the vaginawhisperer.com. And there's a quiz right on there where you can take, and it goes based on your symptoms and your life stage. And it's not perfect, but it does give you a sense of, oh, if I'm having tailbone pain and painful sacs and I've been working out more and doing a ton of squats, it's probably a tension issue. Or if I'm straining with bowel movements and I'm a heavy weightlifter and I'm leaking urine, it's likely a weakness issue. And so you can start kind of going down those paths to know which direction is good for you. I also have this quiz in my book, Floor It, as well. So it just gives people a starting place to say, like, which one am I? And the thing is with tension is we think you're a muscle specialist, Dr. Wright. And so you know that muscles can be weak, but they can also be tight. And when you have a tight muscle, you can't contract that muscle well. It's like if you have headaches because of your tight upper traps and cervical spine, you're not just going to do like, more shoulder exercises. You want to do massage and yoga and change your posture and maybe some dry needling and really release that muscle tension and then retrain the muscles once they're in their more relaxed state.
You may think your bones are fine, silent, but if you're a woman over 40, your bones are talking to you. And unbreakable bone is how you answer back. During perimenopause and menopause, your bone loss can triple without us even knowing it. That is why I created my 8-shield Building Better Bone program, including Unbreakable Bone Nutrition Augment. Built on clinically studied collagen, microcrystalline hydroxyapatite, and the essential micronutrients your skeleton needs. It's the only formula designed by an orthopedic surgeon who spent 25 years rebuilding bone, muscle, and movement. Stronger bones are the foundation of a longer, more powerful life. Start building your unbreakable era today at shop.drvondawright.com. Why do you think women have normalized the pain, the suffering, the leakage? Why is it so normalized or not talked about?
Yeah, and I have a big sigh here because this is the most heartbreaking part of all of this is I think for decades, women have been told that these changes to their body are normal and that they just have to deal with them when that is absolutely not true. You and I both know that there is a dearth of research on women's health and particularly pelvic floor health. So we always say all of these studies are done on male bodies and then they shrink it and pink it and try to make it appropriate for females. And that is not possible in this case. So there's a lack of research. The other thing is that this is a topic that people are really uncomfortable talking about. Physicians aren't screening for them. Patients aren't going in talking about them, and they don't even know who to talk to about them if they have vaginal pain with sex or tailbone pain or bladder leakage. And so some of it is just starting these conversations from a top-down perspective with training medical providers in residency and medical school and in the clinic, and then also telling patients like, hey, this is actually no amount of leakage is normal, not even a little bit with a cough or sneeze. No amount of sexual pain is normal, and really helping them advocate for themselves to say, you know what? I want to be able to run and not pee my pants. I want to jump in the bounce house with my kids for their birthday. I want to lift weights at the gym and not think I'm going to pee myself. So it's really kind of helping women know that this is not normal and then helping them get to the right resources for help.
Exactly. And normalizing the talking of it instead of normalizing the silence around it. So before we get into real action steps, I was so encouraged the other day. I was visiting my, we have children of a broad age range and many of them are millennials and 3 of them are having their children, right? And so I just love being around all these smart young women going through this life's change. And for the first time, I heard about going to a pelvic therapist during and before pregnancy to figure out how to give birth in a better way. I'm like, what? Are you kidding me? That would have been so helpful versus lithotomy, weird position to... How amazing that these young women are going preemptively to prehab or precondition one of the biggest marathons of our life, which is giving birth. I want you to talk about that, but it was just struck me because if we start that early, one of the big reasons women in their elderly years end up in nursing homes, in addition to our brains, in addition to not being able to get up from a chair, is chronic incontinence that cannot be dealt with at a home. So let's get to that eventually, but let's now start a life stage discussion about the pelvic floor, starting with these remarkable young women in their early 30s who are having my grandchildren going to pelvic floor therapy. Holy cow, I love that.
I love that. And it brings the biggest smile to my face to know that the work that pelvic floor therapists are doing to really advocate for this care that we know can be so helpful in not just helping overcome issues, but preventing them. I had been a therapist, a pelvic floor therapist for 10 years before I was pregnant with my first son. And I went to pelvic floor therapy and I did all the exercises and the stretching and the perineal massage and had such a great birth, no tearing, had a great postpartum recovery. And all I could think is, this is so hard postpartum and motherhood without a physical ailment and like a beautiful birth. What are women doing when they have problems? And why am I the lucky one who chose this path to know how to take care of my vagina during pregnancy, but no one else is getting that information? And so that's how the Vagina Whisperer Instagram account started. Was I thought every woman deserves this information, and there's so much we can do to help prevent issues. As you said, our bodies are changing during pregnancy. It's one of the biggest physical transformations we'll go through. And your core is lengthening and weakening. Your pelvic floor is lengthening and weakening. And we're never taught how to give birth. I think historically when there were less medical interventions, it maybe happened a little bit more organically. But now in a hospital setting with lack of mobility or medications, which are all very helpful, but we have to educate women and teach them how to do this. And so that's what we're doing in pelvic floor therapy during pregnancy. And I absolutely recommend folks to get that training, whether it's, in person, whether it's through my book Floored, my online app that helps you kind of understand how to not just strengthen your pelvic floor during pregnancy, but also relax it. And then giving you guidance for recovery during postpartum. Because, 9 out of 10 women will have pain with sex after giving birth. Over 60 to 70% will leak urine and have pelvic organ prolapse and low back pain. And these are all things that we can help with. Instead, again, the narrative of being like, oh, this is just part of motherhood. You're just going to have to deal with it.
And if you are choosing to have multiple children, you want to get everything back in working order as far as you can before you pile on another pregnancy, right?
Correct.
Yeah. It's like, am I right to consider this almost like an injury? Like I would rehab you from an injury or prehab you against injury, rehab you after injury, because we're all going to go back out to our performance state. Well, having a baby is a performance state, people.
Correct. And you said it exactly right. In other orthopedic conditions, we have this model, we have this protocol, but we have not thought about how do we make that same thing happen for women during pregnancy and after birth. And it is the exact same situation. And it really goes to how we need to have, pelvic floor therapy prescribed during pregnancy. We need to have in-hospital care immediately postpartum in the acute care setting. And then we also need to have, training afterwards. And I would say that, when I was writing my book and it's so exciting because you kind of are learning more as you're writing, diving into the research. And I came across an article that told me at 6 weeks postpartum, which is when most women are going to their doctors or midwives and getting a checkbox that says you're good to go back to your pre-pregnancy exercise, your pelvic floor muscles are functioning at 50% of their strength. So we're telling women, go back to your normal life, and not even normal. It's an enhanced life with lifting babies and strollers and carriers and, injury, but your body's functioning at 50%. There's an absolute lack of postpartum care that I think our country really needs to enhance to help moms stay out of pain, to have more babies, to get back into the workplace.
I love that. So that's for the reproductive age women, which for me went up to age 40. Many women are having their multiple children at that age, right? But then, estrogen begins to walk out the door as we have ovulated or used or by attrition most of our eggs. It's estimated, as you know, people have heard me say this before, we have 1% to 3% of our eggs left at age 40, such that OBs call women like me geriatric mothers. Thank you. But without the estrogen, which contributes to all good things in our body, including collagen synthesis, and it's estimated we lose 30% of our collagen. What happens to the pelvic floor then? Let's just say otherwise functioning pelvic floor then, not to mention non-functioning. What happens then?
It gets weaker. You know, when we have less estrogen, when we have less collagen, your pelvic floor muscles get weaker. The ligaments that support your pelvic organs get weaker. And you have thinning of the vulva and vagina, which can lead to higher risk for infections, more bladder urgency and frequency, and painful sex. And so we start to see all of these things happen. They can happen postpartum as well when your estrogen stores are low if you're lactating or breastfeeding. And the tricky part now is we're having babies later in life. So you're going from this postpartum period into this perimenopausal period, and it's one kind of blur. It's a one blurry season, and you're going, wait, is this perimenopause or is this postpartum? And it's this combination of all of these things. And so I am a huge fan of proactive pelvic floor training during perimenopause because I don't think we need to wait until menopause hits when we have no estrogen to start training our pelvic floor and strengthening. So I'm like, this is this flashing yellow light during perimenopause where you can start strengthening your pelvic floor, you can start using topical estrogen, you can start strength training to fill that cup to make those muscles stronger. So when you hit menopause, you have more in the tank versus if you were to do nothing and then you're already kind of swimming upstream when you get there.
Because around 52, depending who you are and what country you live in, is when you stop all menses and the effect of estrogen, unless we're optimizing our hormones, which is every woman's choice. Is it too late then at 52?
It's never too late.
Oh, good. That's the next question, because you know my work, all the things that are going to impede the pelvic floor, I tell people to do. We're jumping.
Yeah.
We're sprinting. We're lifting heavy.
I know, and I watch you and I'm like, Dr. Wright's telling him to jump rope. And I'm like, oh my gosh, my patients would be like, Sara, I can't do that.
Well, they do say that. They do. What can I do besides jump rope? And there's so many things they can do, right? Because balancing, we're going to die of a fracture versus a UTI and a pelvic prolapse, right? It's all the things we need to work together. So it's never too late, thank God, right?
These are skeletal muscles. Like, is it ever too late to start strengthening your biceps or do core work or do squats? It is never too late to strengthen your pelvic floor. And so we've worked with women in their 60s, 70s, and 80s who have prolapse, who have incontinence, who have sexual pain, and they're getting great results. But I'll tell you, the number one thing that they say is, why didn't anybody tell me about this sooner?
Why didn't I start earlier? Wouldn't it be amazing? Like, look at what the midlife and menopause and female longevity conversation has done in the last 5 years. Imagine in 5 years when, if we wake up one day and it's all standard.
Yeah.
It's not discovery.
That's the
standard.
dream, and even your daughters-in-law saying like, I'm going to pelvic floor therapy during pregnancy, that the needle has moved in the past 5 years because this is something that wasn't happening before. And you mentioned that, if you imagine what in 5 years this could look like for pelvic floor care. And that's really, we're already seeing that starting to happen when it comes to pregnancy and birth and postpartum. And I am so excited for the same thing to happen for the second half of our life when we talk about midlife and beyond, because we know those changes. And as a 43-year-old perimenopausal woman, I'm like, again, I'm at a life stage where I know what's happening. I can be proactive about it. And I'm saying every woman should have this information. And I want them to be able to jump rope. I want them to be able to do single leg balance and all of these things that all of our amazing doctors are telling them. But we've got to get that pelvic floor in shape to be able to do that.
Absolutely right. And so I'm so encouraged that I now in my practice have so many early millennials or mid millennials. You're a mid millennial coming in and like, I'm going to get in front of it. I just love that. Things that I'm a Generation Xer, we didn't know, and it hit us like a brick wall. Hopefully it will never hit anyone like in your generation, like a brick wall.
I'll say this really quickly. The work that you're doing is helping the next generation. And I hope that that's what happens. You're doing this for my generation, your daughter-in-law's generation, and that is where the ripples go really far, is that somebody saying we can do better and then doing better.
Absolutely. So in your book, Floored, the framework, and tell me if I'm wrong, I don't think I'm wrong, but is all about education, actually. Education over the secret embarrassment. We already talked about the whispering that goes on. I mean, I get why that happens. But what is a concept from the book Floored that you think can radically change women's health outcomes if it were more widely understood? We may have covered this already, but is there one concept or a small group that could really change the trajectory of women's health?
I think when we look at what can we be doing now that can prevent pelvic floor issues down the line, I don't think that we have to wait for something to happen in order to start addressing it. And, the way that I kind of designed the book Floor was that you could read through it in entirety, or you could pick it up and say, oh, I'm pregnant now. I want to read through the pregnancy and postpartum chapters, or I'm in menopause. What does Sara say I need to do for my pelvic floor during menopause? And we don't have books. If you go into a bookstore, there's thousands of books on yoga and meditation and nutrition. And I'm going, there are no books on the pelvic floor, yet this is a crucial part of our body that women need to understand. And so my goal is to help them understand their bodies better, to have a language for advocacy if they need to talk to their doctors about it, to know what's normal and what's not. And then I also think to feel less alone. These issues are often very embarrassing. We suffer silently with them, yet they greatly affect our quality of life, how we perform in the workplace, how we perform in the bedroom, how we can exercise and show up as moms, as friends. And I think that I want women to know, over 18 years of practicing, I've seen thousands of women with these issues, and you just don't know about it because you can't see it, like a knee brace on your knee or a shoulder sling. But I want women to know, like, there's a book out there because these issues are common, but they're not normal and they're very treatable.
So let's go down that road right now in a very tactical way, because I think by this point people are like, yes, and I got to know what to do. So in a tactical way, and I know we can't demonstrate here, and they can go to your app to see, but what are the things besides education, besides looking in a mirror every month, that you can do to get in front of pelvic floor weakness?
So I think the first thing you might chuckle at this, is I want people to pay attention how they're peeing and pooping.
Oh, good. Let's talk.
Yeah. Okay. Because it's something we do every day, several times a day. And if we're not doing it properly, it actually can contribute to pelvic floor issues. So when we talk about urination, what's normal to go is 6 to 8 times a day, maybe about every 2 to 4 hours during the day. If you're a person who's going to the bathroom every time you leave the house, every time you get somewhere, every time you go in bed, every time you get out of bed, every time you leave the gym, you're training your bladder to have more urgency and frequency, and that's going to contribute to overactive bladder. So I tell folks, only go when you have the urge to go, and also don't delay the urge. There are people who don't like to pee in public, or if you're in a surgery, you have to delay the urge to go. I really recommend going when you have the urge to go.
So holding it is a no-go.
Holding is a no-go. And this is for all the doctors out there, because doctors and nurses, and teachers, because I know that y'all are in situations where you can't just walk away.
Right.
But when you do pee, sit down. Don't hover over the toilet. That's going to help your muscles relax better. And don't push. Don't push when you pee.
Oh.
I think so. Yeah. Just say no to power peeing, because this weakens your pelvic floor and leads to incomplete bladder emptying. And if you're doing this 6 to 8 times a day, every day,
that's a lot of training.
That simple task could weaken you and lead to prolapse. So sit, pee, breathe, don't strain, and then don't push. And then just wiggle your hips, wipe, and walk away. That's how you should pee properly.
Interesting. Why is pushing bad? Because it increases the pressure and the prolapse?
That's correct. It will weaken those ligaments, stretch and strain those ligaments supporting your organs, and it can weaken the pelvic floor. And it can actually lead to incomplete bladder emptying because when you're pushing, you're not relaxing your muscles. You're actually tightening your muscles and then you're pushing against them. So just sit and chill, and your bladder's a muscle that will push the urine out. You don't have to push.
So if you push and then you get up and then you have to go right back, that's what you're talking, incomplete bladder. And then you're feeling like you have
Correct.
to go to the bathroom. Like, I just went to the bathroom.
Correct. And then you push again
Yeah.
to get those last little drops out. And so it's
Yes.
this cycle. So I always say, just say no to power peeing. And I have so
Should
many
be a
women telling
t-shirt.
me, right. They're like, Sara, every time I pee, I think of you. And I'm like, well, great. Then I'm doing my job, you know?
Oh my gosh. No power peeing. Okay. But there are 3 openings in our pelvic floor. What about the third one?
Pooping. So the best position to relax your pelvic floor muscles and specifically the anal sphincter is squatting. So when you think about when you give birth, your knees are kind of hiked up towards your chest. If you are in other countries, you squat over the ground to go to the bathroom. But because of Western toilets, we don't have that ability to squat. So getting a stool, or they call them squatty potties or little step stools, and you put that under your feet when you're having a bowel movement, and that helps relax your pelvic floor muscles to empty better without straining. Also, exhale while you're pooping instead of straining and holding your breath, kind of blowing out like you're blowing out a bunch of birthday candles. And what you mentioned earlier, hydration, fiber, and exercise, like the 3 things that none of us are getting enough of, but those are integral towards easy, soft bowel movements because, again, straining will also weaken your pelvic floor during bowel movements.
Gosh, when you just lay it out like that, it sounds so simple, and yet nobody knows.
Right. Correct. It is so simple. And I think when people think of pelvic floor training, they're like, oh, it's another thing I'm going to have to do, or I'm so busy already. But there are these really small changes you can put into your day that have a really big impact. And the last one I'll talk about is breathing, because I think that that is so integral to pelvic floor health and we don't know how. If you have pelvic floor tension, what we find is that people are often not breathing big, deep diaphragmatic breaths. They're holding their breath, they're chest breathing. And so just putting your hands on your ribs and taking big, deep rib opening breaths relaxes your pelvic floor. But if you are lifting weights, if you are lifting something heavy, whether it's a stroller into your trunk, whether it's weights at the gym, whether it's pushing a piece of furniture, you should be exhaling with exertion because that also prevents that pressure down that will go towards the vagina and weaken the muscles. So exhale with exertion is my third tip.
Oh, that's good. Everybody can do those 3. Let's learn at least the description around a proper Kegel, when to do them, right? Because I guess we're not doing them if we have a tight pelvic floor. We're doing them if we have a lax
Correct.
pelvic floor. And so, what is a proper Kegel? When do we do it? And when I'm in the gym, what are a couple things that I can do? Because you're right, people are sitting here going, okay, right, you want me to power lift and then you want me to do accessory lifts and now I have to pay attention to my pelvic floor, but I don't think they're mutually exclusive. I think there's a lot of redundancy if you just know what you're doing.
Correct. So a Kegel, it's a pelvic floor muscle contraction. So again, these pelvic floor muscles sit like a basket and they have the openings. So when you do a Kegel contraction, it's a closing of those openings and a lifting of the muscle. So it's a squeeze and a lift. It's not tightening your tush. It's not holding your breath and squeezing your legs together. It's so subtle. So a couple of cues I tell people when they're learning how to do it properly. This is the best one. As I say, okay, sit up nice and tall. You need to have a nice neutral spine or lay flat on your back, nice neutral spine. And I want you to think about sipping up a thick smoothie with your vagina. So it's like a sip up. It's a lifting up. It's not just a tightening. And that lifting up closes the vagina. It closes the urinary and anal sphincters together. And it turns on those deep core muscles, those deep transverse abdominal core muscles. And those muscles work in conjunction with the pelvic floor. Some people, you can use a mirror and you should see kind of the vagina closing or the anal sphincter closing if you use a mirror. You can also try it during urination, but I say only do this one time because you shouldn't do Kegels when you pee. But if you're urinating and you want to try to stop your urine stream, that's also a Kegel contraction, but
Oh,
only do it once.
right.
And so that's a way to do it. And then you have to also fully relax afterwards. You cannot walk around with a
With
tight Kegel contraction and think that your muscles are going to get stronger. It's like walking around with your elbow flex, being like, oh, I'm strengthening my bicep. You need a full contraction and full relaxation. When you're in the gym, you can absolutely bring that contraction into the workouts that you're doing. You're likely already doing it. You're thinking of an abdominal brace or kind of that pulling the belly button towards the spine, but focus on also that sucking up the smoothie. And there you've got that pelvic floor contraction coming into a workout you're already doing, giving you more power and strength. And then there's your pelvic floor workout. You're building it into something you're already doing.
That is great news that we don't have to do extra. What do you think of the glute for the pelvic floor, the glute exercise where you're laying on your trunk, your knees are bent to 90 degrees, and you put a sandbag, I love to do these actually, sandbag or bars across the pelvic, and then you're just contracting with your glutes, raising your rear end for a flat look like this, people. So is that good for the pelvic floor?
It's great. So if you have weakness and you're trying to strengthen, glute bridges like that one, loading glute bridges, squats, lunges, things you're already doing. And I also like putting something between the thighs, like a little exercise ball or a yoga block. Turning on your glutes and turning on your inner thighs help overflow into the pelvic floor. Those are accessory muscles for the pelvic floor. That's why when you have to pee and you squeeze your legs together, that turns on the pelvic floor to prevent leakage. So that's a great exercise. But the key is you don't just want to do that exercise without recruiting that pelvic floor first. So I always say pre-contract the pelvic floor and then lift. And, make sure again that you're exhaling with that exertion part of the exercise. And it takes a little bit of practice, but once you finesse that, and then you can start loading with the sandbag, with the weights. But absolutely, it's a great way to strengthen your pelvic floor when you pull in that muscle first. And then again, you have to relax completely afterwards.
And just recover. I think we're running from station to station. I work in this place by design that has an indoor football field. And one of the most beautiful things is laying down on the football field or anywhere, it doesn't have to be, and just relaxing after a hard set, right? Just letting everything out. Yeah. So nothing you've said is prohibitive. It's not like you didn't just tell me to do 32 extra minutes. You just taught me how to do the things I'm going to do anyway in a more effective way.
Effective way with some, pelvic floor awareness. And to your point, if we're focused a lot right now in our healthcare on like tightening, but you have to balance. So doing some, exercises afterwards, like child's pose or happy baby pose or a deep squat to relax those muscles so that you're not just tightening and then walking about your day. You've got to also balance it with some relaxation. So getting the full range of motion of those muscles. And then just having some awareness of like, oh, am I pushing when I'm peeing? Am I delaying the urge to have a bowel movement? Am I holding my breath while I'm lifting weights? Just bringing a little of that awareness into your day. And if you don't have a strengthening routine, you can do pelvic floor workouts, again, in my app, or, there's other programs online that are just like 10 minutes. And I'm like, it's not 50 minutes 3 times a week. It's 10 minutes that you can really train these muscles and build up their strength and feel confident that you can run or laugh or sneeze and not wet your pants.
I notice, because there have been different periods in my life, and just it comes and goes, where I will have trouble with incontinence and then I'm fine. And I find that it takes, and maybe this is just where I am, but I want your perspective on how long is this going to take to get control. I find that once I focus for a very short amount of time, I'm able to correct it. Is that just because I am focusing on this, or always doesn't take 3 years to correct this.
Oh, not these are skeletal muscles. So it's like, how long does it take to build your biceps up? How long does it take to get stronger quads? I mean, it can take as little as, I would say 4 to 6 weeks of really doing training where you can start to see results. Now, the tricky part is people say, like, do I have to do this forever? And I always compare it to like going to the dentist. I'm like, okay, if you don't take care of your teeth, you maybe get a cavity and you get it fixed. But do you still have to brush and floss your teeth even after you get that fixed? Absolutely. This is part of our day to day life now, just like strength training. I've been sick and I've had sick kids home. And so I haven't done my strength training regimen in like 3 weeks. And I looked in the mirror this morning. I was like, oh, my butt is falling off again. Like, doesn't take long to
Yeah.
see those like gains go away. And so it's the same thing. But if you're building this into something that you do, it's part of your lifestyle.
That's
It's
right.
not
It's a lifestyle.
just
It's a
rehab from an
standard.
injury.
Well, and to your point, it's a lifestyle. I mean, we just talked about doing squats, putting something between your knees. I often encourage people who are working from home, from a computer, answering phone calls, pull up a wall, do a wall squat, put a ball between your knees, and you're going to get it all done. You're going to do your pelvic floor, you're going to do your glutes, and you're going to get some work done. I mean, I love when people send me pictures of themselves doing that, because it doesn't have to be added every day. It has to be incorporated. And that's just what you said.
And the same thing with your jumping rope, regimen is that even if some folks leak, you can still jump rope. That will build up your pelvic floor muscles over time. Some folks are like, I don't want to leak. Well, I'm like, okay, well, let's think of a different exercise for you. But you can still do these activities and start seeing gains over time. But it does take time to build muscle. And my hope is that people feel encouraged by this, not by like, oh, another thing to do, but that we're kind of giving you like a little warning sign of like, hey, we know our bodies are going to change. If we don't take care of them, I always say like diapers should not have to be our destiny, because these issues don't get better with time. As we age and our hormones change and our collagen changes and our muscle strength changes, it doesn't get better, but we have an opportunity to really optimize our health. And more women leak urine than have diabetes, hypertension, or osteoporosis. So this is a key to really kind of that longevity and that really fulfilling active life that we all want.
Absolutely. I love that perspective. And as we're winding up, I think sometimes women actually need the language that they need, I mean, even verbatim, to how do they advocate for themselves. So you've given us a lot of tools, what we do at home, how we feel these things, what we do in the gym, resources like your book Floored or the app that goes with it. But give us the words, if we're finally getting up the courage to ask our clinician about these, what should we say? What are the questions so that we equip women to advocate for themselves?
Absolutely. So the number one and two things I want you to know is that leakage and pain are information from our bodies. And so if you're experiencing any of these issues, you as a person don't dismiss them, pay attention to them. I would go to your medical provider. Most medical providers are not asking about these symptoms. So I would have the courage, go in with that thought in mind, saying, this is what I want to achieve at this visit. You can even do a telehealth visit if you'd like, and say, hey, I'd like to talk to you about something. I'm experiencing X, pain with sex, weaker orgasms, something falling out of my vagina, urinary leakage. And if they respond to you with, it's normal, give it time, there's nothing I can do for you, you have to find another medical provider, because you need to find someone who is going to actually listen to you and not gaslight you, because these issues are not normal. If you do get that response, you can say, I think I have a pelvic floor issue. I've had people bring my book into their doctor's offices.
I've got this.
Yes. And say like, she says that this is not normal. I'm like, throw me under the bus. I'm fine with it. Right.
Yeah.
And then say, I'd like to pursue pelvic floor therapy, or can you refer me to another physician who can help me diagnose this issue, whether it's a urologist, a gynecologist, an orthopedist. And so I think that not every physician is versed on how to navigate these issues. We need to be, but you do need to know how to refer. And all you can say is, there's a pelvic floor therapist. You can Google pelvic floor therapy in my area. Pelvicrehab.com is a website you can go to check out for one in your area. But you can also go into any pelvic floor therapist in this country and get an evaluation without a physician's referral.
I'm glad you said that. People don't know that in many states, physical therapists can treat for up to a month or 12 visits.
Yes.
Without
yes.
a prescription.
And also, we also know the medical providers who are versed in pelvic floor health. So if you come to me and you say, I have a prolapse, and I say there is some decreased tissue support, I'm going to send you to the urogynecologist in my town who I know is wonderful, and we work really well together. So sometimes we have the right doctors to send you to. But this isn't doctors' fault. It's a systemic issue that we have not researched or addressed these issues. And just having these open conversations, I think, will empower a lot of women to go in and not feel alone in their issues, to advocate for themselves. But there's also options. If you don't want in-person care, you can do telehealth, you can do online programs. There's a menu of options to really get pelvic floor training now.
Sara Reardon, pelvic floor therapist, author of Floored, resource to this country on pelvic floor health. Thank you so much for teaching us today. I just hope everyone will really take to heart what we've talked about and realize that common does not mean normal or okay.
Yeah. Thank you.
Yeah, thanks for joining us.